As most or all of your listeners know, the typical symptoms of a relapse can be blurry vision, double vision, weakness, numbness, coordination problems, walking problems. And the important aspect of a relapse definition is that there's no other explanation for the symptoms. And we know that many things can make previous symptoms worse. And so what we call pseudorelapse is a worsening of symptoms, particularly pre-existing symptoms that are not from an MS relapse. And an infection is a very common trigger of worsening symptoms that turn out not quite to be from relapse. So what we looked at was whether COVID and other infections would trigger a relapse and whether they would trigger a pseudo-relapse.
And what did you find?
What we found is that non-COVID infections were associated with a risk of relapse after the infection. And these are relapses that were identified by our participants and their care providers, their MS providers. So the non-COVID infections were associated with a slightly higher risk of infections. But fortunately, COVID infection was not. And in fact, COVID was associated with a lower risk of a relapse after developing the COVID infection. Now, I don't want to go so far as to say COVID was protective against relapse, but at least we observed from the data that our participants reported that the frequency or the risk of relapse was lower after a COVID infection than no infection at all. Now, what we also found is that all infections, both COVID and non-COVID infections, were associated with a higher risk of pseudo-relapse, that worsening of symptoms that were not considered to be a relapse by the person's MS provider. And during the period after infection, there was about a 75% higher risk of a pseudo-relapse for either COVID or non-COVID infections. And importantly, patients who were unfortunate in getting COVID and non-COVID infections together, the double whammy, they had a threefold higher risk of a pseudo-relapse. So it highlights how different infections may combine together to really worsen symptoms that are called the pseudo-relapse.
Well, considering all the information from these 3 studies, what do you see as a takeaway when it comes to understanding how infections